I'm the President and CEO of the Westchester County Association, and this is the premiere episode of Business Insights, a new live streaming series jointly presented by the Westchester County Association and Westfair Communications, which, as many of you know, publishes the Westchester County Business Journal and the Fairfield County Business Journal. The WCA has been presenting these video events for a couple of months now on issues as diverse as managing a remote workforce, cybersecurity measures, and accessing small business loans and grants through federal and state programs. All of these videos are accessible on the Westchester County Association website and on our Facebook and LinkedIn pages. This series that we're starting today is an exciting new collaboration between the Westchester County Association and Westfair in order to reach even more people through our mutual networks and communities. So welcome to all of our new watchers today. This show today is going to be about maximizing safety for employees and mitigating risks for COVID-19 in the office environment. The prevention measures that businesses should implement, how to address employee concerns, and how to address situations where an employee or coworker has contracted the virus. We're very pleased to be joined today by our expert panelists, Dr. Sherlita Amler from the Westchester County Commission of Health. She's the Commissioner of Health in Westchester County, and Peter Linn, who's a Managing Director at Marsh, a global leader in insurance brokering and risk management. In a moment, I'll introduce Peter Katz, who will moderate the panel, but first, I want to give thanks to our platinum sponsors. Now bringing back Peter, who's a reporter, writer, and copy and video editor at Westfair Communications, who'll kick off today's show. Thank you all for joining us, and welcome, Peter.
Well, thanks very much, Michael, and we're delighted to be here. All of us over at Westfair, when we put together the Westchester County Business Journal, Fairfield County Business Journal, WAG Magazine, and a whole bunch of digital newsletters, are very excited to have the opportunity to use our news gathering resources together with the Westchester County Association to possibly provide new insights, new meaning to what's going on in Westchester that affects business and also affects the personal lives. And right now, as we all know, we are in the middle of a world pandemic with enormous global impacts and also impacts right here at home in Westchester. The novel coronavirus, COVID-19, has really changed our lives, and it has affected our businesses to a great extent. And with us, as Michael mentioned, is Dr. Sherlita Amler, the Commissioner of Health for Westchester County, and welcome, Dr. Amler.
Pleasure to be here.
And also Peter Linn, Managing Director of professional services firm Marsh. Now they specialize in risk, and Peter's been studying strategies for coping and dealing with COVID-19. Welcome, Peter.
Thanks, Peter. Delighted to be with you all this afternoon.
And Dr. Amler, let us begin with a quick update here. Right here in Westchester County, we are about to move into phase 3 of the reopening. That is supposed to start on Tuesday, all things being equal. And that comes against a background of there being 8.5 million cases worldwide of COVID-19, more than 450,000 deaths. In the U.S. alone, we have 2.2 million cases and at least 120,000 deaths. Here in Westchester, it's been running about 1,500 or so deaths in Westchester. The caseload has been around 30,000 or so. Dr. Amler, can you give us a quick update now as to just where Westchester stands going into the phase 3 reopening on Tuesday?
Well, luckily our case counts are down. We're averaging somewhere between 20 to 40 cases a day. Our hospitalizations are down and our deaths are down. So I think we're in the best shape we've been since this started, and hopefully that trend will continue.
And Peter, you have been studying this very carefully, and you also have been working on putting together some of the basic facts, some of the parameters that exist now into a presentation. I wonder if you'd like to start on that.
Yeah, we're gonna start on the presentation. I'm going to move my presentation here forward, and I'm going to start by speaking of a little bit about the phases that we see within any pandemic cycle. It's important to note that COVID-19 is certainly not the first pandemic. We've had pandemics in the past. Many of you have read and heard about them, going back to the Spanish flu in the early 1900s, but even more recently, it's not the first, and it's not going to be the last. But as we have studied the resiliency of the community, the resiliency of the business, we do see three phases in terms of how we respond. And that is a response phase, which is the immediate response that we all underwent, probably starting in, probably late January through February, early March. We then go into a recovery phase. And then we also have a resiliency or continuity phase, but it's important to note that these phases are not necessarily distinct. There are overlaps on these phases, and in fact, the response phase, as an example, is actually not over. We're still responding to COVID today. Many of our businesses are attempting to recover, get back into business. Others have not actually stopped, even as COVID was occurring. And the whole notion of resiliency and future planning for future impacts. Also, many of our businesses are thinking about that now, but other businesses have been thinking about it, from the beginning. And at the end, we're really talking about this in four dimensions: the dimensions of people, the dimensions of the business operations, the dimensions of our customers, and very importantly, the dimension of the community. And I know that Dr. Amler was very much involved in the response phase in Westchester County in the state of New York. And Dr. Amler, would you like to add something to that response phase?
Well, in Westchester, our response phase began in late January with international travelers who required testing and quarantine. And then in early March, we had our first case of COVID positive individual. And that required that we shift gears to contact tracing, case investigation, trying to understand where people were getting the disease, who they might have given it to, and then other public health measures such as isolation and quarantine. But as you said, this is a continuum, and here we are in late June, or middle of June, and we're still in the response phase, working towards recovery.
Now, as we approach Tuesday, we're going to see more and more businesses open. On Tuesday, if all goes well, restaurants will be able to start serving patrons inside instead of just outside as they've been doing now. We see more businesses bringing more employees back. Now, what do you think the most important thing that a business should be thinking about now is as we go into this next phase? Dr. Amler?
Well, certainly the safety of their staff and their patrons has to be priority. You don't want your facility to be a cluster. You don't want people to get sick from your facility. And so ensuring that individuals are properly masking, social distancing, and that no one ill is coming to work can help prevent the spread of disease. And I think that has to be number one.
And I fully agree with that. The welfare and safety of our employees, our customers, our vendors, our visitors has got to be the top priority. And that's what we're going to be spending most of our time speaking about today. What are those key considerations that businesses need to be thinking about when it comes to bringing their employees, visitors, customers, the community really back into the workplace, as well as considerations around what decisions are we making about reopening the business, when and how. We're going to talk a little bit this afternoon about prioritizing employee health, well-being, as well as security, the critical people, clients and suppliers that we need to be thinking about as they get into our businesses, as well as the identification and proactive management of any potential claims or litigation that comes out of the decisions that we're making today. One of the things that I like to say as I'm speaking about this topic is that the people that are coming back into the workplace are not the same as the people who left the workplace. all of us who are listening to this right now have been affected by COVID in some way, whether it's a family impact, a close association impact. It could be a physical impact. It could be an emotional impact. It could be a psychological impact. All of us have been fundamentally altered in some way by this. So one of the things that we talk about is that because we have a different group, if you will, of people returning back into our businesses, we need to take very careful care and empathy thinking about the impact that this has had on people, because it has fundamentally changed individuals. We're hearing that a lot of employees actually are eager to come back to the workplace, but although they're eager to come back to the workplace, there's also a certain amount of trepidation. There's a new level of risk that they perceive. Am I putting myself or my family at risk associated with coming back to my workplace? Am I putting myself or my family at risk by working with my coworkers? And all of this underlies the issues and the considerations that we're going to be speaking about here moving forward.
And as we speak about those issues and considerations, let me just point out that if any audience members have questions, you can use the comment section on YouTube below where the video appears, or on Facebook below where the video appears, and we will try to answer your questions as time permits later on in the program. Okay, so now, Dr. Amler, are there specific recommendations that you as the County Health Commissioner would have for a business which is now starting to bring the public onto its premises, which is bringing back its employees?
Well, there needs to be entrance protocols. So you want to know that the people that are coming to work are healthy. So how can you manage that? How do you know that? Well, first of all, you can ask basic questions. Provide them with a list of symptoms for COVID and ask, have you had any of these symptoms? Have you been exposed to anyone who tested positive for COVID? And if so, when? Temperatures. There's a lot of confusion around taking a temperature. What we're really looking for is a fever. A fever is a temperature greater than 100.4, not 104, but 100.4. And certainly any individual who has a fever of 100.4 should not be reporting to work and should consult their physician. Social distancing, making sure that people understand that to be a contact, by definition, that's you were within 6 feet of somebody who tested positive for COVID for at least 10 minutes. So it's not just how close you are, but there's also a time frame that's put into place. So social distancing, staying more than 6 people away, and the use of masks, and we'll talk about masks later, but masks have a very important role in protecting people, can help keep your employees safe. When it comes to the facility, making sure that the chemicals that are being used are appropriate. This is not the time to use green cleaners. You need a cleaner that will actually kill the COVID virus. Social distancing can be assisted by taping in areas where lines might form. So you're taping tape to show what a 6 foot distance looks like. Signage around masking, signage around washing their hands, signage for elevator capacity. There can be a lot of signage used. And in elevators, I'm even seeing circles on the floor of the elevator so people know exactly where to stand. All of these can be important guides and tools for the public to know how to respond and how to work within the space that they're in.
And Peter, from the standpoint of the business operator, what do they need to do in the way of determining in their own mind whether they're ready to handle this?
All the things that Dr. Amler just correctly commented on are things that are valid considerations and even actions to take. From a business perspective, what we're looking at is really 3 phases, if you will, of return. And the first phase is, are our people actually ready to return to the workplace? And is the workplace itself actually prepared and ready to have the people return to it? And there's a number of things we should be considering when we're thinking about that. First of all, what is the criteria that we are using to conduct that evaluation? That are we actually ready? Meaning, are the people ready? Is the facility ready? What are the criteria that we need to use? Which people should return? It's very possible that not all of our people should return. We need to decide who needs to return, when, and how. The safety measures, many of the measures that Dr. Amler mentioned a moment ago, which ones do we want to implement? It's important to note that some of the measures that Dr. Amler mentioned a moment ago, they're not all required. These are best practices, and best practices and actions are going to vary to some extent from business to business based on the type of industry, the location, etc. What about the recovered employees, people who have been infected and have recovered? What are we doing there? What are we doing about commuting? Our employees have to get to the workplace and also have to return home to the workplace. There are considerations there that depend a little bit on where the business is located and what the process is. And lastly, and certainly not leastly, the decisions that we make and the basis for the decisions that we make are critical, because we want to make sure that we are mitigating any future workplace litigation risks that are stemming from the decisions that we're making today.
Now, Dr. Amler, we've heard a lot about contact tracing, which is where if someone comes down with COVID, you as a health commissioner, try to trace the contacts that person may have had, possibly spreading the virus. Is it necessary for a business to be at all concerned with contact tracing, or is that something that's strictly in the government's purview?
Well, actually, the health department, we do have a lot of contact tracers who reach out to individuals who've been named as a potential contact to a known case of COVID. We will actually reach out to the individuals themselves. We do encourage them to tell their place of work or individuals that they've worked with that they might have been exposed, but sometimes people don't feel comfortable doing that. They may be afraid that it could impact their job, and so that's why we take that on if they are not willing to. They're certainly able to do it if they want to do it, but we also do it as well. And that just enables us to keep people who could potentially become sick from exposing others, and that's how we really stop this disease, is by finding people before they're ill, isolating them, and preventing them from giving it to other people. And without that, you cannot stop the disease.
And now, Peter, from a business standpoint, what are the other potential people considerations that one should have?
So we spoke before. I spoke before about the notion of being prepared to bring the people back and having the facilities back. But once we've got people back in the workplace and we have our facilities ready for that, utilizing all of these safety precautions, what are we doing to take care of the people once they're actually back? And what we're talking about here is we're talking about issues that have to do primarily with human resources and the benefits available to our people. As Dr. Amler said, we've got to take care of our people as the first and foremost issue as we're thinking about this. So some of the things we're talking about is compensation. Do we need to adjust our compensation and reward systems, both for people who have returned to the workplace, as well as for those who may be indefinitely staying and working in a remote basis? What about behavioral health? Things such as EAP, virtual care, additional sick days associated with the potential for issues arising out of this longer term staying away, or for that matter, coming in. What about the remote workers who are going to stay remote? How do we engage them? How do we support them moving forward? They're in a so-called new normal situation, but they're still our employees. They're still providing a valuable service. What about other human resource policies that may need to be adjusted? What we're hearing is that in some cases, we have businesses that are anxious to return people back to the workplace. In some cases, we have businesses that have kept people in the workplace really throughout most of this. In other cases, we're hearing from businesses that have absolutely no urgency whatsoever to bring their people back into the workplace. And frankly, some of them are talking about not bringing people back into the workplace until the fall. And some, we've even heard, not until 2021 are they going to be bringing people back into the workplace. So there may need to be an adjustment from a human resource perspective. And of course, injured workers, right? People who have contracted the disease or have potentially been exposed. How are we handling their return? And how are we handling the return of people who may have other issues that increase their risk if they were to contract the disease, whether that's an at-work situation or a community situation?
Well, do you treat that as a worker compensation claim, for example, if someone picks up the disease while on the work premises?
So this is a very, very complicated matter, and that question depends greatly on where businesses are located. Different states and different jurisdictions have different views on this. One thing we do know is that if an employee is in an industry where you're logically or expected to interface with people who are infected. As an example, people who are in the emergency services area, in the hospitals, emergency responders, for example. Well, certainly, if they're going to be communicating and coming in contact with people who may be have this virus, there is a reasonable chance that you can say there's an expectation that yes, perhaps they could have received this from work. But if you're not in those types of organizations, the connectivity or the causality between being in the workplace and coming down with COVID, it's not an easy causality. And there's a lot of discussion happening about this right now throughout the country. So it's not a simple answer unless you're in in an industry where you're going to be routinely contacting individuals who may be infected.
Mm-hmm. Now, when employees are back on the job and we're supplying masks to them, you're supplying the hand sanitizer, the offices are being thoroughly cleaned and sanitized at night, what do we as business operators have to know to be sure that all of these things are effective? Dr. Amler, would you like to take part of that? And then perhaps, Peter, you have some thoughts on what do they have to do as business operators to be sure that people are convinced to use masks, to use the hand sanitizer, to take advantage of all of the efforts that a business operator may put forward in order to protect employees?
Well, I think a lot of it is around education. We have to educate people as to what constitutes risk, how can they be exposed, and how would they contract COVID. And we know that a lot of times it may be family members that are essential workers that are going out into the workforce that are bringing the illness back into the home. And so it's, the workers want to protect themselves, but they also want to protect their families. From a health department perspective, what we do is we identify cases. And once we identify the case through surveillance, then we can put that individual into isolation. Isolation is where you isolate, you remove from circulation, so to speak, a person from the workplace or the community, ask them to stay home, to not be around other people until they're no longer infectious to others. And then, as we talked about before, the contact tracing, where we're identifying those individuals and asking them to stay home. So you could have workers in a work situation who either become positive, and they may not even be aware that they're positive, because some people have no symptoms who have COVID, but they may have, for whatever reason, had a test done and are identified as being positive for COVID, so they would be isolated and isolating their contacts, because you don't want these individuals in your facility, in your business, spreading disease. So very important to remove them and to find as many people as possible who might be spreading the disease and isolate and remove those by quarantine.
How do you
I
rate?
would understand that notion about education and training being an absolutely critical factor here. One of the challenges that we're all facing around COVID-19 is that we're learning more about this on almost a daily basis. So the information that we had a month ago versus the information we have today versus the information we'll have a month from now, it's changing. So one of the things that we need to be thinking about is whatever procedures and policies we're putting into place now are based on the best information that we have available to us now. But we need to make sure, we have to have a mechanism in place to be sure that they're actually working as intended. And that includes speaking and communicating with our employees, training our employees, educating our employees, and monitoring them. We need to be proactively looking at the possibility of workers' compensation claims. Workers' compensation claims, as we speak to many businesses, there is an expectation that workers' compensation claims will rise as people begin to get back into the workplace. Simple example, people who have previously been involved in very manual types of jobs, those individuals who perhaps have been home now for 2-3 months, haven't been able to return to work, they've in effect become out of shape, if you will, to do their job. They have an enhanced risk of sustaining an injury when they come back, especially if they come back quickly. What about if there's a resurgence? When we're hearing right now in the news that there are areas of the country, not in Westchester County, which is great, but there are other areas of the country where we're seeing a spike in cases. What are we doing to be prepared for that? If it does happen, what are we going to do? Are we going to need to adjust our policies and practices? When this first came up in let's say February, a lot of businesses really were not prepared for the pace of change and the pace of response that was required. Now we're in a little bit of a different position in the sense that if we are anticipating some type of a resurgence, we can actually more effectively plan for that now. And related to that, what are the measurements? What are the key indicators that we need to provide our executives so that they can make effective decisions about the future needs of the workforce? And in some businesses have increased their workforce as a result of COVID. Other businesses have decreased their workforce as a result of COVID. Knowing what's coming as effectively as you can allows our businesses to respond and plan accordingly. And again, the last thing is, which I mentioned before, potential workplace litigation associated with the decisions that we're making, critical to consider moving ahead.
Well, what should a business do? I mean, should you be stockpiling hand sanitizer, having cases of that on hand? Should you be hoarding N95 masks? Dr. Amler, what should a business person do?
Well, I totally agree with the fact that flexibility is very important, and the messaging that I'm telling you what I know right at this moment, and that could change tomorrow, so that people don't come back and say, but you told me this and now you're telling me that. We have to upfront tell them, we don't know everything there is to know about this virus. We're writing the book as I am speaking to you. We're literally trying to figure this out as we go. What is the incubation period? What does the testing mean? It's all very new, and it's a brand new virus, so everything is novel. But what I can tell you, for circumstance, let's talk about masking. When this first happened, we told people N95 masks are for healthcare providers and nobody else needs to wear a mask. And that's what we thought at that moment. And now we realize that masks, which may be cloth, they may be surgical masks, actually work very well to protect other people from your secretions and from the virus getting onto surfaces. So we now know that everyone should wear a mask, whether that's a cloth mask or a surgical mask, and that helps prevent the spread of disease. It's not a substitute for social distancing, but with social distancing can really reduce the amount of people who become sick. We talked about cleaning and the fact that although this disease is really person to person, surfaces can become contaminated, and you can touch a surface on which the virus landed through a cough or a sneeze and then touch your eyes and introduce the virus to yourself. The virus can remain viable for several days on certain circumstances, on certain surfaces rather. So very important that surfaces are cleaned. And how does the employee know whether their workplace has been properly cleaned? Well, consider letting the employee clean it themselves. Give them the equipment, the sanitizers that they need, the wipes, and let them feel comfortable about their own workspace. Social distancing, we have to make it a priority. This is not a time to put 100 people in a room for a conference. You want to keep the numbers small, you want to keep distance between your employees, and you want to remember that time is a big factor in how this virus is spread. So if you can make a meeting very short, that's how it should be. If it can be done on Zoom or a webinar, even better. We have to be creative about how we keep people safe by social distancing and masking and other ways that we do know can work.
And what about testing? What about testing? Is testing something that every employer should be concerned with? And can you give us a rundown as to the various types of testing? I know we've heard a lot about antibody testing, and how useful can that be?
Well, testing is an area where people are very confused. So antibody testing, all antibody testing will tell you is that if you test positive at some time in the recent past, you had COVID. You were exposed and you developed COVID. Now, this information is useful if you want to donate your plasma for plasmapheresis for potentially helping someone who is critically ill with COVID. But it does not tell you if you have immunity. It will not tell you if you are immune to the virus. So if you get a positive antibody test, that doesn't mean you cannot wear a mask and not practice good social distancing. We don't know how long the antibodies you have are going to last, or if they provide any immunity at all. A PCR test, which is the nasal swab test, that's the one that most people know about. Go into the drive-through testing, that's what they're getting. So they're putting a swab up the nose, and this detects the RNA of the virus. We also don't know, so if you have that, you obviously had, if you have RNA to the virus, you obviously had the disease, but we don't know how long those tests are positive. So if you had a positive nasal swab today, you don't need to repeat that tomorrow or the next week, or maybe not even for the next month, because it may remain positive. That doesn't mean that you're necessarily infectious. We're still trying to determine really how long can a PCR test be positive, and if you were tested positive in March and you're testing positive today in June, is that a new exposure, a new disease, or is it you still have the virus left over? So there's a lot about the testing we really don't know. But what I can tell you is if you get a positive PCR test and you have symptoms, then you are infectious to others and you need to be in isolation.
And what about taking temperature? Should every place of business have an electronic thermometer and be screening everyone who tries to enter the place?
Well, as we said, a fever would be anything greater than 100.4, and that is something that employers can measure. When someone comes into the workplace, you can take their temperature and know if they had a fever. But let's remember that there are other causes for fever than COVID. Certainly, if someone has a fever, they should not be in the workforce, and they should have a conversation with their physician and looking with what other symptoms they have to decide if COVID testing would be important. But it is very important to remember that about 40% of those people who are COVID positive have no symptoms at all and are not going to have a temperature. So relying on temperature alone as a screening, you're going to miss about 40% of the people who actually have disease. So it can't be the only thing that you're using for determination as to whether employees should be in the workplace.
And Peter, I know a lot of what you do at Marsh hinges on strategies, hinges on data, and you have some pretty interesting data on COVID-19 and people returning to the workforce. Can you give us a rundown on that?
I sure can. And we asked a group of our clients during the month of May. So what are you going to be doing? Because one of the challenges is that we have is that there are no hard and fast rules consistently around the country. We have guidelines in place. We have recommendations in place, but with some few exceptions, there are no hard requirements. So we were curious as to what are our clients doing. And the on-site temperature testing or screening is something that you can see 78% were implementing that. Now, one thing I'll mention is that as we look at this is all from the month of May. It's quite possible that in fact, it's likely that some of these things are going to change. But the on-site temperature testing was clearly the most common. The on-site symptom questionnaire, for those of you who have been perhaps to a doctor's office in the last month or so, you may have, as you walk in, they do a temperature screen, and then they ask you to fill out a form that says, have you had any of these symptoms, yes or no? And then we've also got self-assessment and verification questionnaires that some of our clients are putting into place. Employee self-temperature checks and verification is another option that some of our clients are embarking down the road, as well as purchasing of handheld scanners. Important to note, though, that on the very bottom of this screen, you see the none of the above. So a large percentage of our clients also said that we're not doing any of this. And that's not necessarily wrong. It's not necessarily right. It's a decision that was made. And one of the things that we talk about, and mentioned it already here before, the decisions that an employer makes for both employees as well as for visitors, based on your geography, your operation, local ordinances, recommendations from council, etc. It's all based on the information that's available now. As we learn more about this, I suspect that this is going to change. As an example, on this list here, antibody testing. Antibody testing, if you want to say perform virus testing, is 5% of that. We would expect that may actually increase over time. We don't know this yet, but we might think that. So this is what people are doing today. Clearly, the temperature check and the questionnaire is the most common control being implemented, but this may also change. In fact, we think it's likely to change in the future.
You know, Peter, we are in a very litigious society. Is your sense in talking to your clients out there that they have concerns about protecting themselves from legal liability as this COVID business unfolds?
Absolutely. This is a huge issue right now. And what we're seeing over the last 30 days, we're seeing an increase in claims being filed associated with liability. Now, to be clear, a claim being filed and a claim being paid are two completely separate things. However, as we're seeing an increase in various types of claims being filed related to various liabilities, and I'm going to comment on a couple of these here, it is something that's very much on our mind. The two pieces of key advice that we would give here is, first of all, consulting with counsel, be that inside counsel or outside counsel, because the laws and the rules and the regulations, such as they are, do vary to a certain extent from jurisdiction to jurisdiction. That's one thing. The second thing, though, is documenting the decision-making process. As our businesses are making decisions as to deciding, okay, for example, the previous slide, what are we going to do in terms of screening and testing? What are we going to be doing in terms of the pace in which we bring people back to work? What are we going to be doing in terms of masks? What are we going to be doing in terms of safeguarding the workplace itself? These decisions are very important, and the basis upon which these decisions are being made needs to be documented. Having clear documentation on that basis is going to go a long way in the event that there may be a future claim or a future allegation. Being able to go back and say, we base our decisions on these credible sources, which might be, for example, the CDC, it might be a local ordinance or a local requirement, whatever that may be, document them. Clearly, issues around Americans with Disability Act, discrimination based on the types of employees that we're choosing to bring back. Again, allegations associated with we need to be careful that as we think about who we're going to bring back, that we're basing that on decisions that are credible and not even from our own goodwill. We're seeing situations where we have hostile work environments or allegations of hostile work environments based on race or national origin. Some of us have probably seen this on TV, where some people, in particular Asian people, have had some issues at the workplace because of this hostile work environment. Of course, OSHA, COBRA, and the WARN Act are related to this as well. And there's a few others that we want to think about as well. Retaliation and whistleblower claims. Where an employee says, I'm not comfortable coming back into the workplace and I'm being in some way retaliated against because I have voiced my concerns. OSHA applies in this case, may apply in this case, but there are other situations as well where an employee may feel I am being retaliated against as a result of bringing up an issue. The whole notion of the remote workforce. We now have naturally we have a much larger population of people working from the home. The interactions that they have, both within the workforce and outside the workforce, are putting them at different sorts of risk factors, let's say. And there can be claims associated with that. I'm now working remotely. Wait a minute, the policies and procedures that were in place before no longer apply to me. I have to have different ones. And last but not least, relates to the privacy and biometric issues. If we're going to be making decisions about testing, if we're going to be making decisions about collecting any types of information, we need to be very careful in terms of confidentiality of that, maintaining confidentiality of that information. And again, there's going to be some local requirements potentially there. There's going to be some state requirements. And then the other thing I'll mention is this. As this issue develops, there inevitably are going to be some court cases associated with this whole issue of liability. And depending on how those court cases go over the next 3, 6, 9, 12, heading into 2020, how those court cases go, there's the possibility of setting some very specific precedents in terms of how the courts are going to be looking at these types of issues. And that is going to have an impact on how these are viewed in the future. But the two things, again, I go back, consulting with counsel and making sure that the decision-making process is clearly documented, showing the basis for the decisions being made.
And we're going to set a bit of a precedent in reminding our viewers that we will take questions. You can just type in your question in the comments box on YouTube below the video or on Facebook below the video. And we do have some questions that have come in. So let's begin with our first question. And it is, we'll start with Dr. Amler. Do you have recommendations regarding face masks versus face shields?
Well, it depends on what you're talking about on face shield. Most people think of face shield as something, first the mask goes over the face, and then the shield protects the eyes because you don't want the virus being splashed into the eyes. There are some new devices where it's more encapsulating, where there's a clear plastic that goes from here up to here, and some of those may be acceptable, but most people would think of a face shield as simply something that is more around the eyes.
Can any piece of cloth really work as being a face mask to protect others from any particulates that you may expel through your mouth or nose? Is there really value in just a plain old piece of cloth?
Absolutely. I mean, you see people sometimes in the beginning, they were just actually using scarves. Mostly what you're trying to do is trap the particles that are propelled from the mouth or the nose when you cough or sneeze. And so really any type of cloth can do that. Or with surgical masks, it's actually paper. They're actually made of paper.
Okay, and let's have our next question from the viewers. Again, for Dr. Amler, could you reiterate the quote, less than 10 minutes, quote, aspect of social distancing. Hadn't heard about there being a time frame associated with social distancing. We know that 6 feet seems to be the standard for social distancing, but how long can you be around the same people?
Well, if an individual is COVID positive and we're trying to determine who they might have exposed, one of the very first things we're going to ask them is, who were you around that you were closer than 6 feet for more than 10 minutes? And that's the initial, and those are the individuals that we would have the most concern about. But going beyond that, it gets into the matter of time. So certainly if you were in a room with someone for an extended period of time, say hours, then we would probably also look at them as contacts. Or say you were in a car with someone and they were driving and you were in the very, very back of the car, but you were in that car with them for an hour and they were coughing. That would constitute an exposure.
Either speaking personally or as a physician or as an official with Westchester County, do you have any advice for people who may be tempted to go to large gatherings? We're coming up on a weekend as we're doing this program where in days there may be a huge event taking place in Tulsa where a lot of people are going to be squeezing into a very large arena, possibly 2 large arenas. And we have seen pictures coming out of New York City of a lot of people squeezing into very small bars, very small restaurants. Do you have any particular advice for people as a doctor, as a county official, and as a person?
Well, I think the most important thing to consider is, what is your personal risk? We know that individuals who are more than 60 years of age, who have underlying medical conditions, it could be diabetes, hypertension, heart disease, lung disease, if they get COVID, they have an increased risk of dying. So if you are in that age group, you have to make a decision. Is this event worth placing my health at risk? For anyone else, because sometimes young people who've got COVID have died too, but certainly the major risk is for individuals who are older. But if it were me, I would be wearing a mask and I would be practicing social distancing, because unfortunately, since we have individuals who have this disease who have no symptoms, I cannot look at you and tell if you are well or not. And I want to take care of my health. So, and the health of my family and anyone else that I might expose. So I think it's up to the person to decide how important is that event and how important is your health.
I think I'd like to add something to that as well, because one of the things that we've been speaking about with businesses is employees that have to go visit other customers or locations or do any kind of travel. And one of the things that we talk about is, much like Dr. Amler just says, we have a certain amount of ability to control our own environment. The 3 things that work, we talked about the social distancing, the masks, and the hygiene. We have a certain amount of ability within ourselves to control those. The social distancing, to some extent, we have that control, depending on where we are. Maybe others not. Certainly, we have the ability to control our own use of masks. And we certainly have to some extent, our ability to control hygiene. For example, hand sanitizer is one of the most basic things we've talked about, is the washing of the hands. So as people make visits, whether it's to a large assembly, even if it's out to a local retail store, being aware, providing them that training and education, and in some cases, from a business perspective, even providing them the supplies which to use, is a very good practice for our people assets.
Okay, let's take the next question from the viewers. Is COVID interruption generally covered by business interruption insurance? And can we still purchase that, or do companies now exclude that specific coverage? Peter?
Okay, that's a question that we get a lot, and typically what we're seeing so far is that much of the business interruption, which I believe the question related to, there were a lot of claims filed at the beginning under property policies. Each property policy is unique, and it's going to be absolutely critical to review the property policy and the individual exclusions with your broker, with your insurance advisor. However, there were, even before COVID-19, there were specific insurance solutions out there that are designed to be triggered by a pandemic. And these insurance solutions cover business interruptions and other risks. A lot of our businesses did not have that type of coverage. Some of them did, and they're fortunate that they did, but some of them did not. It's certainly not possible now to go backwards and buy retroactive pandemic insurance for COVID-19. But that being said, there are more options out there right now for future pandemic coverage, if you will, that many of our clients and our businesses are giving serious consideration to. Because as I mentioned earlier in the program, COVID-19 is not the first pandemic, and it's not going to be the last pandemic. Some pandemics we've had even recently, SARS, MERS, H1N1, they're actually not that long ago. They're within the last 10 years, and they didn't spread quite as far and didn't quite have the impact that we're feeling now with COVID-19. But more and more of our businesses are thinking about, wait a minute, I think I want to be at least considering the purchase of a pandemic business interruption insurance moving forward.
All right, and let's see what our next question may be. Well, another insurance question for you, Peter. Is there insurance businesses should consider purchasing now?
Well, just as we were just talking about this whole notion of the pandemic insurance, which again, it was available previous to COVID, but again, most businesses did not have it, did not buy it. It is something that more and more of our clients are considering now, because we now have new products out there which are being customized specifically around the needs for pandemic. So there's more options out there right now than there were before. And that is really one of the key areas in which our businesses are thinking about right now in terms of new products out there to be preparing for and protecting themselves from a future outbreak.
Okay, and we have another question, and this one is for Dr. Amler. And the question is, what is the danger to meeting people out of doors without wearing a mask?
Well, that would depend on the distance. And so if you're outside and you're more than 6 feet away, your risk is less, but we certainly would still want you to be wearing a mask. People have to make their own decisions. So outdoors are better than indoors, and wearing a mask is safer than not wearing a mask. And the farther away you are from the person, the better. Simple as that.
The Westchester County parks facilities are going to be open to a certain extent. We have golf courses open to a certain extent. Activities will be going on up at the Kensico Dam, at Playland, and the parking lots there. They'll be doing some events, even a graduation or two. What is your message to the people of Westchester County, both residents and also business people who have special responsibilities to their employees?
Oh, wow, that's a tough question. I think that people want to get back to life, to life as normal as they possibly can. And so we are trying to put measures in place around like summer camps, swimming pools, parks, to enable people to do that. And I think it's really around listening to the measures that are suggested and following those measures and taking personal responsibility for yourself and your children or your family. I mean, you heard Peter say hand washing. Hand washing prevents most public health, all those pandemics that he was talking about. A lot of them could be prevented by hand washing. And so, washing your hands and all these things, because there are things that we can do. People feel like they're helpless in this situation. We are not helpless. You have things you can do. The decision is whether you choose to do them or not.
And if there is a second wave, do people need to be concerned about there being a second wave?
I think we are already seeing that in some areas of the country where numbers are increasing, where there previously were not the kinds of case counts that they're now having. No one can tell you for certain whether we're going to see this again in the fall. I think we have to be prepared. We have to assume we might. We have to prepare for it. And if it doesn't happen, great. But if it does, we'll be prepared to respond and to keep the numbers as low as possible.
And Peter, do you, from your viewpoint at Marsh, have any recommendations to business people? What do business people need to do now? What do they need to do in the future? And what do they need to worry about should there be a return of the severity that we have seen in the past?
Yeah, as I mentioned earlier, the initial response to COVID came upon us very, very quickly. And candidly, many businesses were not prepared or ready to respond as quickly as they would have liked to have been. Now that we've gone through this process in February, March, and essentially we are still going through this process right now, hopefully we've learned some things along the way. And again, we've talked about the most important aspect of our businesses being our people and our human capital. So having a plan in place right now to first of all, address the issues that needed to be addressed in terms of the response and recovery, but also have a plan in place to say, okay, if there is a second wave or if there is a spike, what exactly are we going to do? Are we going to send our people back home? And this is going to depend to a certain extent on the industry and type of business that you are in. If you're in a business where you've actually experienced limited disruption in terms of having people be remote, well, that might be a relatively easy decision to make. On the other hand, if you're in a business where you really are relying on people to be in the workplace, that's a little bit more of a difficult decision to make. And what are those triggers? The considerations specific to your business are critical to be thinking about. Have a plan, execute the plan, but be nimble. And when I say be nimble, be ready. We know things are going to change. We're confident that between now and a month from now, there's going to be different information available to us. The situation is not going to stay static. I think we would all agree with that. So we need to be ready to adapt to the situation as it goes. And the last thing about this is empathy and care. And I mentioned it earlier on. Empathy and care of our people in this time is very, very important because people have been impacted by this. People need to trust the business community. People need to trust the community at large. We want to encourage that. So we want to the extent that we can be empathetic, show caring, show that we're putting our people first, I think is a very important consideration moving forward.
Well, Peter Linn, Managing Director at Marsh, and Dr. Amler, do you have a closing remark?
Well, I was just going to say that, we've talked about the fact that this is a changing situation. Going forward, we may see that there is the availability of a vaccine. There may be availability of drugs to treat COVID with. We may gain the knowledge of whether having a positive antibody test does mean that you are immune to this disease. So there are going to be changing circumstances. And so what we know now, what we're facing now, how we're responding now, probably won't be how we will respond if there's a second wave. So it's just like stay tuned and we will see how this story evolves. But no matter what happens, I think we'll be, we're positioning ourselves and companies should position themselves to have the best possible outcome.
And Dr. Sherlita Amler, the Commissioner of Health for Westchester County, thank you so much for being with us. Peter Linn, Managing Director of Marsh, again, a big thank you to you. And on behalf of the Westchester County Association and West Fair Communications and WCA's Platinum sponsors, we want to thank you for joining us for this first edition of Business Insights. We hope to be back with you in the not too distant future to talk about another issue of great concern to Westchester residents and Westchester businesses. I'm Peter Katz. Thank you very much and good day.